I think the other really nice kind of update is around the treatment of cancer in primary. So, I mean, last year we were just talking about the launch of a really interesting phase 2 trial called CUPISCO, and now that is live and we're recruiting really well on it. We're learning a lot of lessons from that study. One is, in fact, the screening failure rate. But that's partly the fact that the trial requires us to really exclude any other cancers. There's some very nice data presented in the poster around the fact that the trial is actually helping us diagnose primaries, whereas in the past we just call them CUPs. And then we felt, the whole community felt it might be quite difficult to recruit into the study, but now we've got over 150 patients into that study, and we're getting patients into novel therapies, which is really, really exciting. So I'm really glad about that. The UK has done extremely well in recruiting. I have to thank the whole team for the sponsors and for the UK to help us run that study. It's in contrast with the presentation of the phase 3 GEFCAPI04 by Fuzazi, and unfortunately it was a negative study. So that was a study of cisgem versus targeted therapy. Now I think some of us could have predicted some of the issues, and this is just a general problem of how trials are designed. Almost feels like a millennia, but only 5-10 years ago, and the field changes all the time. And who would have ever thought that cisgem chemo would cover all the bases? And I think the phase 2 setting of CUPISCO clearly is a better way to go. Having said that, we've got a beautiful biobank really of patients from GEFCAPI, and I think it's definitely for the investigators of that study to make sure that we learn from some mistakes, but equally it has a huge kind of biobank of really interesting data and tissue that they could do profiling on and still learn lessons from that negative study. So I think that's still very valuable and exciting and worth publishing.